There we go. All right, welcome everybody. It is the 19th of September. We've been doing these Zoom calls for well over a year now. And if you're new to all of this, please look back on the Facebook page. We have indexed them. I need to update the index. It was about a month ago that I did that. And so you can look on that Word document index sheet and see which ones you want to listen to, so that we're not just repeating these over and over, even though I don't mind answering the questions again. If we did answer them multiple times in the past, I would ask that you would look at those posts, those past Zoom calls. That's the whole purpose of them. So questions are good. They're good because we can get answers. But sometimes I don't have the answer. So understand, I will always be honest with you. When you guys ask me questions, if I don't know the answer, I'm going to say I don't know the answer. It might be a question that I may want to look up and figure out the answer, because that's how I learn. And I've done that all my 30 years of practice is I've learned from my patients. And I mean things that they've taught me, and also questions that they've brought me that sparked me to find out what that answer was. So I see that as a challenge, and I see that as my purpose. But also, I am not your Google. So I'm not here just to answer every question that you have. So just remember that. And certainly, I just don't know everything. I'm just not that smart of a guy. So bear with me with all of that. So we're going to jump on to some questions that I had come in. One was a question particularly pertaining to me, but we could pertain it to other people as well. How can someone get cancer if they've been using the Rife for years? And the question came in on email. How could you get cancer if you have been using the Rife for all these years? I really struggle with that. But we need to understand some things, okay? So to answer that question, there's a multitude of facets to this. So number one, the Rife machine is frequency dependent. So, for instance, in my case, my wife had melanoma. We were running melanoma programs for a number of years, and my cancer is not melanoma, and melanoma is a skin cancer, very different than my cancer. So I wasn't running the right programs specifically for my cancer, even remotely. So when I say frequency dependent, it means that you only get the benefit from the Rife depending on what frequencies you're running. So you could say, well, how come I got the flu? I've been using the Rife all this time. Well, if you're not running cold and flu and viral and bacteria programs, you're not killing any cold and flu and virus and bacteria. If you're running Lyme programs and you got influenza bug, you haven't been running influenza bug. If you're running cancer programs and you got some other disease, it's frequency dependent. So it's dependent upon the frequencies that you're using. That's what's going to be the thing that's going to be hit. So if you're not running the right frequencies, then you're not going to help yourself in that thing that you're trying to prevent or trying to cure. Number two, understand the Rife is limited by distance. If the Rife is, farther away from you, you're going to get less benefit. And I've said that the Rife could be 8 feet away from you and you're going to get some benefit, but it's going to be very little compared to if the Rife you were snuggling with the bulb. So there's actually a physics formula every 12 inches or 10 centimeters. I don't know what the calculation is. Again, I think it's every 12 inches you move something away from you, you half the benefit of the frequency. So if the bulb is 5 feet away from you, you're going to get a whole lot less benefit from the frequency than if it's next to you. So it is limited by distance as well. And then three, you have to understand, the Rife is not a magic wand. It is not a panacea for every disease. And to think that if I have a cold virus and I'm going to run a cold program and my cold is going to just go away, you are delusional. It is not going to happen that way. It can, but to think that anything, whether it's a vitamin, oh, if I have a cold, so I'm going to take vitamin C and my cold goes away, to think that's going to happen every time that you take vitamin C or garlic or echinacea or run the Rife is you're not being realistic. Um, it's really important to keep that in balance. The Rife machine is a wonderful tool, but it is a tool. Tools have to be used correctly, and tools are just that. They aren't. If I have a chisel, it doesn't mean I'm going to be able to sculpt Michelangelo out of a block of clay, or sculpt David out of a block of stone. It's going to be. It's how that tool is used is important, and it's simply a tool. So it's whoever's using that tool is going to make a big difference too. Um, Whoever placed the thought in anybody's mind that the Rife machine is any guarantee of a cure or prevention of any disease was not me. So I have never stated that the Rife is any sort of cure-all for anything, and you know that. So don't get tricked into thinking that, and don't think that that if I'm using the Rife for my cancer now my cancer is going to go away. There's so many other factors that are involved with this that you're not being realistic. So make sure you take, I am an optimist, maybe. Maybe some people would say I'm a pessimist. I think, honestly, I'm a realist. We just have to be realistic about things and keep things in perspective. We don't want to have unrealistic expectations of anything that we do in life. I think that could lead to disappointment. And when we have unrealistic expectations of something, like we think that the Rife is going to cure our cancer. Now that I'm using the Rife, I'm gonna be fine. I'm gonna be cured. And one would say, well, how can you say that, Dr. Connors? You're taking away hope from somebody. No, I'm not. I'm trying to just keep it real. Um, if we have such unrealistic expectations on a machine like the Rife machine, or in vitamin C therapy, or in chemotherapy, or in my oncologist, or because I'm going to the best doctors at Mayo, that's really, from the truth of that, that's idolatry. And that does not have a place in our life. It certainly doesn't have a place in our clinic, and I'm certainly not going to advocate it. And if that's what you're going to stick to, then I think you're going to have some unfortunes that come along with that. There exists also a myriad of causal considerations to any disease. So even if I was running the Rife for 5 years prior to my diagnosis of cancer, and I was running the exact right frequency all those 5 years prior to my diagnosis of cancer, does not mean I'm not going to get that cancer. I hear this all the time from people, um, quite frequently at least, that how could I have gotten cancer? I have been eating right. I've been eating organic for 10 years. I've never smoked. I've never drank. I've never done anything bad. How can I get cancer? And that's a struggle that people have. And I think it's a fair question to ask. But then the my question back to you is, how do you think that you have lived all these years and not gotten a serious disease or not gotten cancer? It falls back to that thought process that we feel like something is owed to us, that we have a right to health and be healthy because of the wonderful things that we've done. Yes, I think that we need to make steps to do wonderful things like eating correctly and not drinking in excess, and taking care of our health, and staying away from EMFs, and trying to live a good, healthy life. But there's no guarantees that you're going to live to 120 years old. There's no guarantees that you're still not going to deal with a serious disease like cancer. There's too many causal considerations to every disease. There's too many things. Even if you're living a perfectly clean lifestyle, you're still exposed to pesticides and chemicals and chemtrails. And I tell people, hey, your shirt that you're wearing right now was not dyed with raspberries. It's dyed with chemicals. You're exposed to chemicals everywhere. You're walking on carpeting that is off-gassing, chemicals from your wall that are off-gassing, pollutants in the air everywhere. You're breathing in things, exposed to things through your skin, exposed to things through the environment. You cannot get away from it. And even if you could, there's still, in even the natural realm, a myriad of things that could cause disease. So to think that you can completely prevent every disease by even doing everything that you know to do to be that is right and good is ridiculous. It just is. So you have to keep that balance. And then lastly, we have to understand, do we not serve a sovereign God? Even if I did everything right that's known to man, that may be future known to man 200 years from now, we still serve a sovereign God. And if he chooses to allow me to get cancer for some reason to bring him glory, who am I to argue with that? If I am, I'm arguing with the God who created me. Besides the fact that I believe that, who am I? Goodness sakes, I've lived 55 years without cancer. Praise God. What a blessing that has been. Do I think I have the right to not get sick? Do I have the right to not have financial concerns? Do I have the right to not have family problems? Do I have the right to not go through crises in my life? We have become such a narcissistic society in America because we live in relative peace and prosperity, that these things we now think that are somehow inherent rights that we have. Whereas really, if we put life in perspective, even on earth today, the majority of people are living on, $30 a day in this world, and we are $30 a week in this world, and we are living in the top 1/2 of 1% of the human race. We talk about what's really fair. We are living in a very unfair world, and we are living in the advantage of the real unfair world. So we really want to put things back in perspective in everything we do. So even though I understand this may have been a very honest question, how can someone get cancer if you've been using the Rife for years? And I don't want to be too, sound too angry with my answer. We have to be careful and hedge ourselves against the narcissistic thoughts that we have a right to something because we're doing the right things. Yes, we are called to do the right things, but just because the outcome isn't what we selfishly want doesn't mean it's not the right outcome. And that's sometimes a hard pill to swallow when I'm a selfish person, who I am. So I have to get over that, and that's one of the lessons in life. Next question: could someone please talk about the hormones, adaptogens, and bioidentical hormones, and dealing with hormones? And sure, I'll gladly talk about that. So here's a picture of your endocrine system. Endocrine are glands that secrete into the bloodstream and have an effect on distant organs. And you have all these different glands in your body that do different things. Your pituitary gland that sits up in your brain communicates to mainly your adrenals, your testes in men, your ovaries in females, affect your placenta, and affect your thyroid gland. And those are your main endocrine system glands that we talk about when someone says their hormones are out of balance. So when we're talking about a woman feeling like her hormones are out of balance and deciding whether to use a bioidentical hormone or not, we're really talking about your hormones of estrogen and progesterone primarily. Now, obviously, when a person has low thyroid, they're on Synthroid or an equivalent of that. And we often hear in functional medicine terms of people with low adrenals, under stress, cortisol issues, norepinephrine, epinephrine issues with their adrenal glands, and needing some adrenal support, especially when they're under stress. Now, there's several different ways to deal with it, and from a natural perspective, there are bioidentical hormones. And that's really one of my degrees is in with bioidentical hormones, though I've never used bioidentical hormones in my practice. And I have some reasons for not using it. I don't have any issue with someone choosing to use bioidentical hormones, except when you go down into the field of helping people with cancer, you can't use bioidentical hormones. You really shouldn't be using bioidentical hormones, in my opinion, even if you don't have a hormone-driven cancer. So now they're hormone-driven cancers, even if you're not ER or PR or HER2 positive with breast cancer or ovarian cancer or uterine cancer, I still would not suggest using bioidentical hormones because we just don't know how that affects the cancer, even if it's not showing on a lab test to be progesterone or estrogen positive. So I would still say no to bioidenticals. But what do you do if you have cancer and you're in a relatively stable place with your cancer, but you have all these hormone fluctuations? Okay, so let's get into that. So then you talk about adaptogenic herbs. So what are the different herbs to help balance hormone function? There's a group of herbs called adaptogenic herbs, and adaptogenic herbs are called that because they tend to balance whether your hormones are a little bit high because you're hyper stressed. So let's talk about your adrenals as an example. So if my adrenals are relatively in a hyper state because I'm in an acute stressful situation, that can cause harm and disruption and symptoms and unpleasantness. And taking adaptogens can help calm those down. So adaptogens can help calm a hyperadrenal, a hyperthyroid state, or a hyperpituitary state, or a hyperestrogen state somewhat. So adaptogens can be really nice that way. But the beauty of adaptogens goes even deeper. If I have a prolonged amount of stress and my adrenals now are dysfunctioning, so I'm not getting the output of my adrenal hormones, so I'm not dealing with stress very well at all because my adrenals are getting burned out, adaptogens help build it up. So that's the beauty of adaptogens. It keeps your hormones within a balanced range, calming a hyper output and boosting a hypo output. So adaptogens are my first choice whenever we deal with hormone issues. But it's mainly thyroid and adrenals with adaptogens, even though I've had numerous patients with obvious estrogen progesterone imbalances, like hot flashes and such, because they're going through their change of life, that use adaptogens to help balance that. So let's talk briefly about going through your change of life as a female. So what happens as a female when you get to a certain age, your ovaries, which are receiving the stimulus from the pituitary gland to secrete estrogen and progesterone, the ovaries start to degenerate. So they are not producing the estrogen and progesterone that they used to produce. That's your change of life. And now you're not having a release of an egg, and you're not having your period. You're not getting proliferation of the uterine wall, and you're not getting your period anymore. Women could go through this change of life and have no symptoms whatsoever and are like, wow, I'm so happy I don't have to deal with my period anymore. Yay, life is better. And then other women go through this change of life and they get all these crazy symptoms because they get their estrogen drops way down and then will spike way up again and drop way down and spike way up. And that's when they get these hot flashes and symptoms like that. And I have never had hot flashes, but my wife has. And she's explained them to me after she threw a pan at me. No, she didn't do that. But she's explained them to me, and they're not very pleasant. I've had numerous patients with horrible hot flash issues, and they're not very pleasant to observe, so I understand that. But that all has to do with this spike and drop of estrogen, because as the ovaries shut down, something is not happening. So what happens in a person going through their change of life that really has no symptoms? They stop having their period, they don't have any symptoms, and they go, this is the greatest thing in the world. That person has very healthy adrenal glands. So your adrenal glands, for a female, your adrenal glands also make estrogen and progesterone. They also make estrogen and progesterone in the male. So males have estrogen and progesterone as well. They're made in the adrenal glands. In the female, estrogen and progesterone are also made in the adrenal glands. When a woman goes through change of life and has all sorts of symptoms, that is a telltale sign that their adrenals are low. Their adrenals are low, and they're not taking up the slack when the ovaries are starting to shut down and they're not producing the same estrogen and progesterone, and you're getting this spike and drop and the spike and drop. The adrenals should step in and help balance that out. But when a woman has all these change of life symptoms, it's because the adrenals are not stepping in and doing their part. Now, the adrenals are never going to produce as much estrogen and progesterone as the ovaries, so you're never going to have your period because of the adrenals. You're never going to have uterine proliferation of the endometrium because of adrenal output of estrogen and progesterone, but it should send you through your change of life without any symptoms. So when a woman has a lot of change of life symptoms, it's because of low adrenals. So the first thing you'd want to support are the adrenals. So then you go back to adaptogens again. So adaptogenic herbs can be really helpful through stressful things. They can be really helpful with anxiety, because some anxiety is because of adrenal gland and thyroid gland fluctuations, because of the pituitary gland fluctuation. And so adaptogens are my first go-to. Other herbs that can be really helpful going through for ovaries issues, for estrogen and progesterone issues, are black cohosh, dung quai, red clover, maca root is really good, and there's numerous other herbs that can be really good. There's some female herbal concoctions that work real well. We use a product called Estrovite. Now, it does have some soy in it, but it's a much lower dose soy. It's a isoflavonoid of soy. So I still use that with cancer patients that are having, really bad change of life issues and need some support for that. But I always try to use the adaptogens first. But products like Estrovite, or there's a lot of other products in the market that are for female change of life issues that are really good products out there that I would use. Somebody asked the question on Facebook of a product, I won't name the company, but the company has a lot of really good products, but when the main component is a soy, we don't want to use that, because that can give us too much estrogen, and though it can be really helpful for the symptoms, but it can cause, especially with a person with cancer, it could cause some problems. So we don't want to have that be our go-to. Now, there's other herbs. So when we talk about hormone balances with cancer, we cannot leave out this little piece. Herbals to decrease hormones in the case of hormone-driven cancers. Now, understand there's 33 different derivatives of estrogen that are in a person's body at any given time. And there are certain ones that we could call the quote-unquote bad estrogens. Now, really, quote-unquote bad estrogens aren't bad estrogens. They are metabolite intermediates, meaning that A converts to B, converts to C, converts to D, and really we want D in our body. But when we have too much B, that intermediate metabolite, that can be a problem. And that's really what the bad estrogens are. They are a B, intermediate metabolite that can affect the estrogen receptors on certain cancers and not allow the cancer to go through, the cancer cell to go through apoptosis. Now, I have a number of different videos on that whole process itself, so we're not going to get into that again. But some of the things that you would want to do from a natural perspective to help that, because you could take an aromatase inhibitor, which are medical drugs, and different tamoxifen and different medications that are out there that your oncologist would prescribe if you're estrogen or progesterone or HER2 positive. But a lot of women don't like to take those because of the side effects of them. The natural things that can help decrease these quote unquote bad estrogens and help pull out too much progesterone are products like DIM, fermented soy. Now, don't confuse soy with fermented soy. Fermented soy products work 180 degrees differently than soy products. Soy products, which I don't think anybody should be eating any soy, whether you have cancer or not, can be estrogen disruptors because they're estrogen-like products in soy, and they can really disrupt estrogen. And eating soy can actually be a cause of cancer. Now, fermented soy tends to dislodge bad estrogens from estrogen receptors, so fermented soy can be a good thing. Now, there's not very many fermented soy things on the market. Now, if you eat traditional Japanese food, miso, natto, and some other things, those are fermented soy products. Of course, you have to develop a taste for those, and you have to have a source for those. The only fermented soy nutritional product that I personally know of, well, there's a couple, but the one that we use is the Sanogastrel. So if you're on a Sanogastrel, you're on a fermented soy product, and it's meant to help dislodge bad estrogens from estrogen receptor sites. Plant lignans, certain plant lignans can be very beneficial too. Plant lignans from hops can help decrease bad estrogens, and we have a product with that in there too. And the sulforaphane products, the Braco Clear product that we use with sulforaphane can do the same thing. So these are 4 good things to take. And these can actually be good things to take. And again, I'm not trying to sell products. I don't want people on too many products, but even if a person does not have cancer, these would be products that you could think of. And certainly if a person does our genetic test and they don't have cancer and they have a lot of BRCA defects and some other defects in the tumor suppressor pathways that could ramp up risk of cancers, these would be products that would be recommended for them as well. Okay, so hopefully that clears that up, understanding that adaptogens are just a classification of herbs that can help balance the thyroid, pituitary, ovaries, adrenal glands. They can be very beneficial for that. Other herbs specifically would be to help balance estrogen and progesterone levels would be some of these, and there's probably multiple more. Other glandulars for the pineal gland. The pineal gland releases melatonin, doesn't make melatonin, but it releases it to help you to go to sleep. So using melatonin can be beneficial. And then what hormone we're talking about. But usually when somebody's talking about adaptogens versus bioidentical hormones, we're really talking about estrogen and progesterone, the adrenals, and the thyroid. Okay, so I'm going to open up for questions in just a second, but somebody sent me a chat and said, if my cancer seems to be stabilizing, tumor markers going down, can you explain why I continue to get ascites in the abdomen and on my right and left chest cavity? The doctors are puzzled. Good question. So ascites is fluid. So ascites is fluid that's escaping from the cells. So ascites is technically inflammation, but usually we talk about inflammation, we're talking about a source being um, some inflammatory source of like an immune reaction or an injury or something like that. Ascites is typically inflammation or swelling from leaky cells. So the the um, the question is, why does a person with cancer end up having leaky cell membranes and get fluid buildup at all? Well, you could Google that, and you're not going to come up with any answers because currently it is not known why that happens. Now, I have my theories, and they're not based upon just my opinion. Multiple people have these theories that our cell membrane health is so vitally important. And that's why when you came to our clinic, we tested you for your phase angle and your total body water in your intracellular versus extracellular water, because that's giving us some snapshot of the health of your cell membranes. Now, unfortunately, there's no way to test the health of the cell membranes in any particular spot in your body. When we put those leads on your hand and on your feet, that's sending an impulse through your body, and it's giving us a collective number. So that's not specific to the abdomen if I have abdominal cancer, or the chest if I have lung cancer. It's going through your whole body. So unfortunately, there isn't a better way to do it at this point. But when we get that number back, that's what's called your phase angle. So that's the charge of your cell membrane. And remember what we said is that we want your phase angle to be as high as possible, because that tells us your cell membranes are as healthy as possible. And it's a relative number. And then we got back your intracellular versus extracellular water. And in a perfect world, it'd be a 60-40 split. 60% of your water is found inside the cell and 40% is found outside the cell, or in the extracellular space, the space between the cells. Now, if that number creeps together, so now I'm at 55-45, well, that's telling me my cell membrane health is less healthy. And as we age, that is most likely going to be true unless you are just blessed with unbelievably healthy cell membranes. But then you're probably not in our office with cancer. So cell membrane health is so important. And I've had numerous videos on cell membrane health, because one could argue that really the brain of the cell is the membrane of the cell, because it is chock full of receptors that the outside environment communicates to the inside of the cell through those receptors and tells that cell how to function. And that's part of the problem with estrogen, progesterone, receptor positive cancer, since we were talking about that. Bad estrogens attach to those specific receptors that are apoptotic receptors that don't allow the cell to go through normal apoptosis or through normal cell death. And then the cell doesn't die, and it can go through rapid replication, and it can be a piece of the cause of cancer. So as a cancer cell is multiplying, it's definitely not going to have as healthy of cell membranes as the other cells, because it's multiplying quite rapidly. And it's going to have the greater chance for it to leak its inside of the cell fluid to the extracellular space. And that's technically what ascites is. Ascites is an increase in fluid in the extracellular space. So that's it. So when there isn't any known scientific reason why, that is the major theory up to this point on why that is. So why are cancer cells more likely to leak fluid? Because with their rapid replication, they're not as healthy, and they are going to cause more fluid leakage. The other theories abound around if a person's doing chemotherapy, that's damaging all their cell membranes, and that can cause ascites as well. If there's numerous, again, just like what is the cause of the cancer, there's numerous pieces to that cause. What is the cause of any given condition right now, which is cell membrane damage and cell membrane permeability is really what we're talking about. There's numerous pieces to that too. And that's where thinking of, so if a person has ascites, think of products like phosphatidylcholine. So remember phosphatidylcholine, which is our phospholine product, or the phosphatidylcholine liquid bottle product that we have, because that is the major component of your cell membrane. So if you want to give the building blocks of cell membranes, give phosphatidylcholine to the person. That's going to be the biggest benefit. So think of products like that that are going to help build the cell membrane. Think of also, lymphatic drainage, lymphatic exercises, anything that you could do to help move fluid, motion, vibration, anything times we've ever talked about lymphatic motion and movement. Those are the kind of things and exercises that you want to do. Also, make sure you get drainage done. So paracentesis, going in there with a needle and drawing it out, or getting a port put in, or a tube put in, a drain put in to get that drain, can give you just an enormous amount of relief, and it can be temporary, and you can get it out as you start to continue to improve. Okay, I'm going to unmute. I have time for maybe 1 or 2 questions.
Doctor, just a little bit follow-up. That was my question. This is Sharon. And I mean, would you be surprised if, like, it seemed like when the cancer started to advance, I was starting to get the ascites, and I hadn't had it for, ever. And except for one time I had gotten drained like early this year when I was doing really horrible. But as I was getting better, I haven't had that happen. And then it just started creeping and getting worse, and now I seem to be turning it around, and it seems to be stable and better. Does it make sense that I keep getting the fluid buildup? Does that go hand in hand with cancer getting worse all the time, or?
No, it doesn't. So I've had people become really stable and basically go into a full remission, but still get fluid building, still get fluid draining. So that's not uncommon at all. Just because the cancer slows down in replication doesn't mean there's still not millions and millions and millions of very unhealthy cells with unhealthy cell membranes that are going to be leaking fluid.
Okay, so, thank you.
Any other questions? Okay, well, we will wrap it up, and I'll get this up on Facebook just as soon as possible. And I wish you all a very blessed day. Have a great day.
Thank you.
Thank you.
Bye-bye now.
Bye.
Thank you.